morning, ladies and gentlemen. On behalf of the Caribbean Public Health Law Forum's plenary, I would like to bid you a very warm welcome to everyone who's made it possible to be part of this wonderful meeting today. Our steering committee members, our forum members, other partner entities and representatives, I bid you a very warm welcome. My name is Shanna Sear-Filbert, and I'm the current chair of the plenary. And I'll be chairing the meeting this morning. I'm also joined with my colleague, Ms. Shira Watley, the co-chair. It gives me great pleasure to welcome you to the 10th plenary session or business meeting of the forum and the 3rd anniversary of the forum. And in order to commemorate the 3rd anniversary, we've brought to you a kind of special meeting, if you want to call it that. We are going to have at the beginning of our meeting a webinar. And that will take up about the first 45 minutes, probably a little more, of our 10th business meeting. And the total duration of our meeting today will be about an hour and a half. The theme for this morning's webinar is a very relevant topic. It's climate change and health, critical considerations and developments. We are pleased to have two very dynamic and knowledgeable speakers with us, Dr. Karen Paulson and Dr. James Hospitalis. Now, in the interest of time, we will jump right into this very engaging and relevant topic. Our first presenter, Dr. Karen Paulson Edwards, is dedicated to working at the intersection of climate change and health. With a Bachelor of Science in Zoology from the University of the West Indies, Mona, and a Master's of Science in Biology and Control of Disease Vectors from the London School of Hygiene and Tropical Medicine, she holds a solid foundation in medical entomology. She then gained her PhD in zoology from the University of the West Indies in 2010. Dr. Paulson Edwards' journey in climate change and health began in 2002 when she contributed to the Intergovernmental Panel on Climate Change project on climate change and dengue. As a fellow of the Millennium Ecosystem Assessment, or MA, she played a pivotal role in the Health Synthesis chapter of the Ecosystems and Human Wellbeing MA report in 2005. Dr. Paulson Edwards' passion and expertise led her to join the Pan American Health Organization, PAHO, in 2018 as the advisor for climate change and environmental determinants of health for Barbados and Eastern Caribbean countries. In 2022, she was reassigned to PAHO headquarters in Washington, D.C. as the regional advisor for climate change and health. In her current role, Dr. Paulson Edwards provides technical support to countries in the Americas, helping them prepare health systems to mitigate and adapt to the adverse effects of climate change on health. Ladies and gentlemen, we welcome Dr. Paulson Edwards.
Thank you very much, Madam Chair, and good morning to everyone. And thank you for that introduction. So I'm just going to share my screen and you let me know if you're seeing. Is all well on that side?
Yes,
okay.
All well.
Thank you so much. So this is a hot topic, hot in more ways than one. As we're talking about the heat, I think everybody's talking about the heat. And so we're seeing that the effects of climate change are very real. So I thank you for this opportunity again, and I will just focus a bit on what's happening at the global scene in terms of the policies, the declarations that have been made when health entered the climate change scene, because health is very new to that scene. And what are some of the things that PAHO is doing in terms of helping countries in the Americas to build climate resilient health systems, and to then focus on specifically what's happening in the Caribbean, as this is a forum of the Caribbean public health law. And so I will not go into everything that we do, but I'll try to keep it focused and have some time for questions. So so you'll tell me if my screen is moving. Okay, so it's stuck. Okay. Thanks. Okay, so just to put things in a bit of perspective, as this, I understand is the first time this topic is being presented to this group. As a lot of people are talking about climate change and the impacts on health, we know of the impacts already on, temperatures, in terms of the increased temperatures and sea level rise. But how does that impact health and health systems? Now, one of the things that we're aware of is that climate change does not impact everyone equally. It depends on the vulnerabilities. So there are some populations that are more vulnerable than others based on demographic factors. For example, for the Caribbean, we're small island developing states, and as such, because of our geography, we are prone to the increased natural disasters, extreme weather events. We're looking at the impacts of on air quality, water quality, food security, and so on. And the health systems, when we speak about health systems, it's not just the health facilities, or it's not just the medical fraternity or so, but the health system also includes the populations that are served by the health sector. And so the health systems themselves, which have to respond to the impacts of climate change, also are vulnerable to the impacts of climate change. And so there are several areas under which we work to try to strengthen the health systems. But when we look at some of the climate sensitive health risks, we're seeing increases, for example, in injuries and death from extreme weather events like the hurricanes that we're seeing more frequent and intense, hurricanes and storms. There are heat-related illnesses, related to vector-borne diseases such as dengue, which has been increasing. I was told by a colleague yesterday that last year we would have seen a record number of dengue cases, but for this year so far, we have already exceeded the numbers of last year in total. So we're coming close to 10 million reported cases of dengue this year. So already we're seeing some of the impacts in respect to the vector-borne diseases. And of course, also with respect to non-communicable diseases and mental and psychosocial health. So from the global, I wanted to give a perspective from the global and then come down to the regional level. So there are sustainable development goals which guide what we do, and these were established by the United Nations in the 2030 Agenda for Sustainable Development. And two of the main goals that we're looking at when we speak about climate change and health are Goal 3 and 13. Goal 3 having to do with ensuring healthy lives and well-being, and Goal 13 taking urgent action to combat climate change and its impacts. So strengthening health systems to be resilient against climate impacts is crucial and is important in order for us to be able to achieve the sustainable development goals. On the global scene, some of the players that are involved in climate change are the United Nations Framework Convention on Climate Change, the UNFCCC, and that was a call to a global response to a call for work on climate change. And then in 1997, the Kyoto Protocol came about, and this was signed by several countries. And this was a legally binding document that developed countries signed to commit to reducing the emissions. So there were some targets that were established. And then this was followed by the Paris Agreement, which was signed in 2015, which also aims to limit global warming to below 2.5%, preferably 1.5 degrees Celsius compared to pre-industrial levels. And we had a saying for a while, 1.5 to stay alive, meaning that we didn't want to exceed the 1.5 degree rise. And already we're seeing in several parts of the world where this has been exceeded. So there are health implications for this. So mitigating climate change then will limit the negative health impacts. And so we're also looking at what can be done to reduce greenhouse gases to aid in decreasing air pollution. And so if that we're able to achieve that, then we can improve respiratory and cardiovascular health. The Conference of the Parties, COP, is another group, and this is the decision-making body of the UNFCCC, and this body meets every year. Their annual meetings, participation globally, and so this is where the negotiations take place, the decision-making and the assessment of progress made in terms of addressing climate change. Now, at COP26, this was the first time that health really had was able to enter that stage, and this was in 2021. And so there was the health argument for climate action was produced as a special report coming out of this COP. And so the report then focuses again on climate resilient and low carbon health systems. And there's the Healthy Climate Prescription Letter was signed by several health organizations from over 100 countries. And health continued to be showcased on the COP agenda. So last year in Dubai, COP28 was the very first time that health had a very prominent place on the climate change stage. And so it was the inaugural health day, and there was a declaration that was produced from this meeting that was signed by countries, and it emphasizes the critical role of the UNFCCC and the Paris Agreement, and also the urgent need for us to confront the connections between climate change and health. So this again is another commitment signed by countries to ensure climate resilient, low carbon, sustainable, and equitable health systems, because of course we cannot not think of and focus also on our populations, which are extremely vulnerable to the impacts of climate change. This year in May, the SIDS meeting, the 4th International Conference on SIDS, was held in Antigua and Barbuda. And coming out of that was the Antigua and Barbuda Agenda for SIDS, the ABAS. And in terms of the focus on health in this particular declaration that was signed by small island developing states, then it speaks to strengthen the health systems, also looking at integrating climate and health policies using the One Health approach, also looking at enhancing the prevention, preparedness, and response of the health systems to be able to better cope with the health emergencies, epidemics, and climate change related health impacts. And again, focused on strengthening or building climate resilient, low greenhouse gas emission, and sustainable systems. So in terms of what PAHO does and how PAHO works, so as you would have seen, then it's all aligned to the global agendas. And so PAHO works as part of WHO, the American arm of WHO. And so there are several building blocks for climate resilient health systems under which we work. So this is our frame. And so we work, the blocks are related to governance and institutional structures. And this is where we work with countries to strengthen the health sector, to be able to negotiate, argue, advocate for the inclusion of health on the climate change stage at the national, regional, and international settings or in different fora. And so also at the national level, the formation of interministerial committees which exist in countries to include health in that particular setting. And so this is where the norms and legislations can be discussed and developed as it relates to climate change and health. Planning is another block under which we work, and in that there are several documents that have been developed, and these documents help to guide countries in developing their health national adaptation plans and including health in what's called their nationally determined contributions, which are the instruments that are submitted to the UNFCCC. And these are documents and instruments that can help to countries to be able to produce or show the evidence, which can then also assist in mobilizing resources for implementing actions. With respect to health infrastructure and services, here we look at the making the infrastructure, the health facilities more smart. We talk about smarting the facilities, making them more green, more sustainable, more resilient, and so on. And under this, we also look at sustainable procurement, because one of the things that we note is that the health sector is actually culpable in terms of contributing to greenhouse gas emissions. So not only do we have to make the health systems more resilient, but also more green and sustainable. And so here we look at some of the practices that are being undertaken by the health sector or the health systems, and then working with them in countries to do the assessments that are needed to produce the evidence and then make the recommendations for what can be done to reduce the greenhouse gas emissions from the health systems. We also work in terms of climate and health surveillance systems, looking at climate sensitive diseases, as I mentioned, dengue earlier, and working with different sectors. Intersectoral collaboration is very important for our work. So working with different sectors, the environmental sector, the meteorological sector, and others, to be able to create what we call integrated databases. So we're able to have all the data in one platform to be able to analyze and then develop early warning systems, which can then be used to help the health sector be more prepared to be able to respond. Health co-benefits is another area in which we work, and this basically looks at making the case for what if we do nothing. So if we, for example, were able to improve the air quality or to increase green spaces, what would be the impact on our health of the population? What would happen if we were able to use more active transportation? And so there are tools that we use with countries to assess what is happening, and then to make some projections based on, okay, if we improve certain things, what would it mean for improved health and well-being of our populations, but also to be able to put a dollar value to it from the economic perspective, to show what it would mean for saving in terms of GDPs for countries. Research and capacity building is another area. So we do seminars, webinars, we do trainings of health professionals, we provide materials and so on, and work with other partners. Dr. Hospitalis will be speaking after. Dr. Hospitalis of Nurse Earth Medic is one of our partners. Especially we do a lot of work in the space of research and capacity building and training, and also the Caribbean Health Research Agenda, Climate Health Research Agenda, which was recently launched. And our final pillar is health and climate financing. So we work with countries to produce a pipeline of project proposals, which can then be submitted to donor entities for mobilizing resources. Specific to the Caribbean, then there are several regional action plans that we have developed with countries, in consultation with countries. And so we have one for the Andean region. We also have one for other countries in Latin America. But the one I wanted to focus on is the Caribbean Plan of Action on Health and Climate Change, which was developed between 2019 and 2023. So it's expired. So we're actually in the process of doing an assessment to see how did we do under this plan of action, and we're due to develop a new plan of action. And so as I mentioned, so this was part of the World Health Organization had initiative for small island developing states on climate change and health. So the one for the Caribbean, the third conference was held in 2018, and the document that came out of that was the Caribbean Action Plan on Health and Climate Change, which was actually signed by ministers of health and ministers of environment or climate change from 23 countries and territories. And we had regional entities included in this endeavor. And this is actually the framework that we have been using for the Caribbean. It has 4 strategic lines of action. It's evidence, empowerment, resources, and implementation. And with partners, we have been working in the Caribbean. We we have been able to mobilize resources from like the European Union and the Green Climate Fund and others to implement actions to strengthen climate resilient health systems. So in a nutshell, this is what I just wanted to present, and then afterwards, of course, I'm available if there are any questions. So thank you very much, Madam Chair.
Thank you very much, Dr. Paulson. Indeed, that was that was a lot of information, a lot of good information. The Caribbean Action Plan for Health and Climate Change, of course, necessary when we consider that we are so vulnerable to the effects of climate change. Now, ladies and gentlemen, I know you have questions. You have to have questions after such, such a wonderful presentation, but I just want to ask you to just be patient. We are going to go into our next speaker, who is Dr. James Hospitalis, after which we will do a general question and answer for both speakers. Dr. Hospitalis is a senior public health specialist with strong expertise in the prevention and management of non-communicable diseases. He graduated with honors in medicine from the University of the West Indies and has a master's degree in community medicine from the London School of Hygiene and Tropical Medicine. He is the CEO and founder of the Earth Medic and Earth Nurse Foundation for Planetary Health, former executive director of the Caribbean Public Health Agency. Previously, he was director of the Caribbean Epidemiology Center and a member of the Caribbean Commission on Health and Development. He was an epidemic intelligence service officer with the U.S. Centers for Disease Control, an epidemiologist at CAREC, and worked for several years in public health for the UK National Health Service. He's a fellow of the UK Faculty of Public Health and an accredited partnership broker with the Partnering Institute of the UK. He has published more than 60 papers and reports. Dr. Hospitalis is now based in Port of Spain, Trinidad. Dr. Hospitalis, welcome and thank you.
Thank you very much. Good morning, all, and thank you for this opportunity to speak with the Caribbean Public Health Law Forum on really what is quite an important, well, from my current perspective, the most important thing we can talk about, not only for health, but for all of civilization, really. Allow me to share my slides. If I could get it right. Oh my goodness, it's also jumping around. Is that showing?
Not yet. There you go.
Yes.
Yes.
Very good. Again, to the Caribbean Public Health Law Forum for this opportunity. I think at the beginning of the forum, I had a little hand in introducing the Caribbean Court of Justice with PAHO and CARFA. So why do I do what I do? These are my 3 grandchildren and my lovely wife. And when I look at these little guys, I think, what kind of future are they inheriting with the way the planet is going now? And that's a big motivation for me to have founded Earth Medic and Earth Nurse. And you see our logo has the earth represented as a green circle with a white cross, which is the universal symbol of first aid. Because patient earth, I use that metaphor, patient earth is in trouble, and we're the cause of it. And if we don't deal with it, we have a lot of suffering to come. And so I founded Earth Medic and Earth Nurse instead of retiring quietly after leaving CARFA to mobilize the health professionals of the world to address the climate crisis, beginning here in the Caribbean as a very vulnerable region. So I hope to cover these points here on this slide in 20 or so minutes. What to say about climate change? Well, I came up with this little acronym, RUBADA. It's real, it's us, it's bad. All the experts agree, but much can be done, and lots of others also agree, including faith organizations. All the Abrahamic faiths agree about this. Judaism, Christianity, Islam, and Hinduism also agrees. There are 3 buckets in climate action, not to be negative, but we can adapt. You may have heard that word, or mitigate, but I'm afraid there's a lot of suffering that's happening and a lot more to come. You only have to look at the fires in Brazil or Canada, the 1,300 people who died on the pilgrimage to the Hajj, the flooding, the drought, the storms, and on and on. So we have a lot more suffering to come, and a lot of action is needed to minimize that, especially on the most vulnerable, as Dr. Paulson Edwards said. Now, just to recap, I can't assume, you said this is the first time it's been handled in this forum. So the fundamental problem is that we are using too much fossil fuel, and that's what's causing climate change and the impacts. And we burn fossil fuels in industry. We burn fossil fuels when America manufactures our food, when Korea and Japan manufactures our cars, when China manufactures our clothes. But we say we're not part of the problem. It's a problem in the big countries, forgetting that they are burning carbon on our behalf. I'm going to make a number of provocative statements during this presentation because I now inhabit civil society, and that is my right and my role to be a bit provocative in things that I will say. If you look at the last 50, 60, or 70 years, the carbon dioxide concentration in the atmosphere, it's going up in virtually a straight line. If you were to plot on this bottom axis the numbers of the COPs, you would start at COP 1 and you'd come to COP 28 or 29 or wherever we are, and you might conclude spuriously that the COPs are causing carbon dioxide to go up. I did say spuriously, but it does seem to be that governments and the UN mechanism is failing us. And people need to get much more involved than they currently are if we're to avoid extreme catastrophe. We already have a lot of catastrophe, but if we're to avoid extreme catastrophe. How does that work? Again, you may know, I apologize. Incoming solar radiation is trapped by the atmosphere, and we need a certain amount of carbon dioxide in the atmosphere to do that, or else the world would be a cold and lifeless place. The problem is we've adjusted the balance. We've tampered with the balance that's been there for 10,000 or so years, and more of that heat is being trapped, and that's playing havoc instead of being radiated back out into space. So the mean annual temperature of the world has started to creep up in the last 20 years, and you see this line here, and that has a lot of implications: heat waves, drought, fires, hurricanes, extreme rain, floods, landslides, sea level rise. This is and we get a lot of this in the Caribbean, epidemics. I'll talk specifically about how climate is connected to NCDs, mental health impacts, of course, and population migration and displacement. This slide is showing the Bahamas Climate Change and Health program, because I actually developed this one for a training program we ran there about 18 months ago. Now, in case the temperature rise on the previous slide did not impress you too much, you say, well, it's only going up by 1 or 2 degrees. What does that matter? Put it into perspective and look at the last 20,000 years and look at the last 10,000 years that humans and human civilization has been the way it is since formal agriculture started. And then look at where we are now and look at where we're going. We have changed. We are changing the entire planet. We're at 1.1, 1.2 degrees. Actually, last year we've had this record heat. We were at close to 1.5, and we're projected to be 2% by 2020 and 4% by 2021 under current policies. And I'm not very sanguine about what's going to happen. That heat is mostly in the oceans. The amount of energy accumulating is the equivalent of 5 atomic bombs per second, every second for the last 25 years. And of course, we live in a very watery part of the world here in the Caribbean, as do other small island states in the Pacific. And so we have a big problem here with the heat waves in the ocean, killing fish, bleaching the coral reefs, damaging our food security, and so on. Where does all that carbon dioxide come from? Well, this chart just sort of summarizes. It's mostly fossil fuels producing energy, transportation, cars, planes, agriculture, and these two are important in thinking about how climate and NCDs can work together in tandem. Industry, our residential and commercial buildings, land use, forestry, these are where the major sources of carbon dioxide come from. Healthcare itself, surprise, surprise, contributes about 4%, 5% of the global carbon footprint. And that means if we're operating under a principle of primum non nocere, first do no harm, we've got to fix our house in the health system. And that's why we're a champion for the PAHO Smart Hospital program, which looks to improve safety, but also improve the green capacity of hospitals to be more climate friendly with renewable energy and so on. Now, climate change is bad. I don't need to say this, but here's Michael Taylor, Professor Michael Taylor, who is a climate guru at Mona in University of West Indies, and he leads the climate studies group. And he has all these U's: unprecedented, unpredictable, ubiquitous in its impact, affecting all of us, our economies, agriculture, tourism, health, of course, education, but it doesn't affect everybody equally. And that's important from a justice point of view. Some have a worse time of it. It's unrelenting. When Dominica was hit by Hurricane Maria in 2017 and absolutely smashed, it was still recovering from Tropical Storm Erica in 2015, which I had been to with the Secretary General of CARICOM at the time. It's unfair and it's uneven, affecting the poor, older adult, people with NCDs and disabilities, people living in certain areas, and it's unimaginable. If you've seen the results of a Category 5 hurricane in the Bahamas or in Barbuda, it's like a bomb exploded. This gets a bit technical, but this is a chart that shows how climate affects health. And at the center are the core climate variables of rising temperatures, more extreme weather, the sea level rising, and that in turn changing the environment, changing the air we breathe, changing vector ecology, increasing the allergens. If I sound snuffy, it's because the Sahara dust has been bad the last couple of days, interspersed with the rain, changing our water and food supply, degrading the environment, and of course the extreme heat. I make a joke when I run these workshops. How you feeling? Hot, hot, hot. People in the party, but it's not a party. It's not fun. And here you see on the outer side, the vector-borne diseases, the asthma, the water and foodborne problems, forced migration and conflict that's happening all over, and the heat-related illness. Bushfires, this is a plague where I live in Port of Spain, just outside Port of Spain, and I'm realizing all over the Caribbean, we're seeing more and more bushfires with the heat and drought. Karen touched on this, and I mentioned it, that the climate doesn't affect everyone equally, and depending on exposure, occupation, your income level, where you're housed, et cetera, and people with chronic medical conditions more likely to have adverse outcomes. This is a health systems model, modified WHO health systems model. WHO uses 6 pillars: governance, finance, service delivery, workforce, information, medical products, and we add community. I believe an informed and empowered community is absolutely essential to a well-functioning, climate-resilient health system. This diagram is modified from the World Bank 360-degree resilience publication. The health system has at its heart the 100 million health workers around the world, about 10 million docs and about 30 or 40 million nurses. But when we've done surveys, 3 studies recently in the last 2 years in the Caribbean, everybody's heard of climate change, but less understanding the main causes, less still understanding the specific impacts on health and healthcare. Less than half have a good idea of what to do. People perceive a lot of barriers. And when you ask about what are you actually doing in your workplace, the answer is less than 10%. And this is a little shock and a wake-up call that we have a long way to go to create a climate literate health workforce and to get more action going in the health workplace, because health ought to be an example to the rest of the community. The next few slides deal with why this is such a bad problem. The emergence of heat and humidity too severe for human tolerance. It's not only the heat that's going up, the humidity is, and the combination of those things are called heat index. So recently I spent about 3 hours outside working at my brother's house to install this gate. I do woodwork, so I had built this gate. And the temperature was 33 and the humidity was 85. And I thought I was going to die. So I went and I consulted the charts, and you realize that 33 degrees Celsius combined with 85 humidity is a feel-like temperature of 51. Dangerous to be out of doors for a long time. A lot of implications for the workforce, for occupational safety and health laws, for sports people, etc. Many people realize, okay, we're going to get more storms, but do they realize they've changed their behavior, that we're in a new climate regime? They are stronger. They are wetter. They intensify faster. Imagine you're facing a spin bowler and you sort of settle in and you think you're going to have time to react. But in fact, no, what's coming at you is a speedball. And that's what happened with Dorian and Maria. They intensified very fast in the last 24 hours. So the population maybe had been thinking, oh, there's just a category 2 or 3 coming. But no, it's a speedball that's coming at you. And they're slower moving that pound you for longer. And this combination of factors is part of the new regime, and it means that the hurricanes are more devastating. They're more deadly. I used to be on the Caribbean PAHO disaster response team for 8 years, and the hurricanes have changed their behavior. The new climate regime is about flooding. We're doing a project now with USAID in a part of Trinidad. There have been 154 floods in the last 5 years in that area. So that's 30 a year, almost one a week. Sometimes in the rainy season, more than one a week. So imagine that your prized possessions are washed out, your car is flooded away, and some of the insurance companies I talked to said, we don't know what to do. We're just paying out so much money in claims for housing, for crops, if you have insurance, and for cars and vehicles. Population displacement and migration, UNICEF publication pointing out that we've seen a 6-fold increase in children displaced by storms, and that includes Dominica, Puerto Rico, the Bahamas, Antigua and Barbuda. I asked this question in the Bahamas at a workshop, how many people are planning to take a mortgage? And a few hands go up, and I said, where are you planning to take the mortgage? And people have their ideas, you know, we all have that dream, well, most people do. And I said, well, let's look at what flood levels are going to look like by 2050 and put up this slide. And then people get very quiet because they realize that where they were thinking of taking the mortgage in 25 years' time, when that mortgage is up, it's going to be regularly flooded or underwater. Who's going to buy that house? Will you be able to live there? So this is part of the new regime that we're in. This is looking at Port of Spain from my house, another manifestation of the problem. Maybe you don't know what this is. This is the city of Port of Spain. I'm north of Port of Spain. And you see, it looks as if you could be in Bangkok or Beijing or something. But this is Sahara dust, but you cannot see across the Gulf to San Fernando. You cannot see the ships in the Gulf. And on mornings like this, even before I go outside, I know it's bad because my sinuses are kicking up. A few words on climate change and non-communicable diseases. In 2016 for the G20, I wrote a joint paper with Prime Minister Timothy Harris on climate change and NCDs as two sides of the same coin, and developed the points around the fact that after an extreme event, you cannot only count the immediate deaths. So in Puerto Rico, after Hurricane Maria, the official death toll was 64. But in the months that followed, something like close to 2,000 excess deaths occurred, and mostly among people with NCDs. If you go to the causes and the determinants, then you find that transportation on our fossil fuel-based transport system has people sitting down and driving around, inhaling the pollution, getting stressed, worsening their diabetes and their hypertension. And by the same token, more active transport like biking and walking would be good for the planet and good for people's health. Diet and food systems, same. The very meat-intensive diets that we eat have a huge greenhouse gas impact. And if we can switch to a more plant-rich diet, not completely vegan, but if we can switch, we can make a difference. In recognition of this, we ran a program of climate and health on NCD's workshop series, and all of these are available free online. We're very pleased to be able to do this. And then last year for the World Health Summit, I wrote another piece advocating for integrating NCD prevention and climate action can improve planetary health. This was for in the publication Health is a Political Choice. I want to spend 2 slides on a number of policy actions that could be considered. I think our heads of government should declare climate resilient health systems a national and regional priority. I think the health ministers, the Council of Human and Social Development, which have to date not adopted a policy on climate resilient health systems, that's what they should do. And we should have agreed arrangements beforehand for the population displacement and migration that is going to happen in the OECS and in CARICOM. So those are some important governance and policy pieces that are needed. We need a sustained, well-planned public education campaign to which people can relate. If this is the biggest threat to public health, where is the public health education campaign to match it? Because people have heard of climate change, but they don't understand sufficiently. We need a training program for health professionals. We need to include vulnerable populations in disaster plans. Some of this is taking place, but we could be better at it. We need a prioritized plan and budget for retrofitting 80% of public health facilities to the PAHO Climate Smart standards and convene donors around this. This is $1 billion project, give or take. We need innovative financing to support some of this. We have to strengthen our surveillance and research. We don't have enough research from the region, off the region, and we need to, there may need to be policy actions to mandate that the health and environment and climate Met services can be more joined up than they are. In Trinidad and Tobago, for example, the health services operate under the 1995 Regional Health Authorities Act. The Environmental Management Authority operates under the 1995 Environmental Act. And the folks who are working in local government, for example, operate under a third act. So how do you bring those silos together is an important consideration. And we need strengthening research. We need to involve citizens and the community and a range of tertiary training institutions, UWI and others, community colleges, to establish the baselines and evaluate interventions. We need to strengthen the practical arrangements for supplies of medicines and diagnostics, especially in emergencies. So those are some policy actions, because I understood that I should comment on the policy actions that come out of this. Karen mentioned this briefly, and I'll just flag it. We're very proud, a product of the partnership of produced the first comprehensive climate and health research agenda for the Caribbean, and the link is here. You can go to it. It's published on EarthMedic, PAHO, and the Yale University websites. And here you see the handsome people that are involved in this project. Let me kind of go towards the end now. Climate change and the law. Last year in an exchange with Nicole Foster, we were talking about the role of the law. So I went and I asked, tried to be modern, and I went and I asked ChatGPT, write a summary of the role of the law in climate adaptation and mitigation. Provide examples from local and state level and international. Indicate promising approaches. And if you've done this before, then you know we have a lightning storm here, folks. If I get cut off, you know why. This is just the summary paragraph of a long spiel that answered this question from ChatGPT. So the law has always helped to protect and promote public health, water quality, food safety, air quality, and so on. And I think it's one of the areas that is promising. I take hope from the global leadership that the SIDS, Small Island Developing States, are providing to move climate action into international law. And I give some examples here. The May 21st opinion of the International Tribunal for the Law of the Sea deemed greenhouse gas emissions to be pollutants. and therefore subject to a range of other laws. The ICJ advisory opinion on the obligations of states in respect, this is in process. I'm very happy that Arithmetic and Earth Nurse, we were able to participate in this and strengthen the submissions from Antigua and Barbuda and St. Lucia to add that health piece, that human piece, to their submissions to the ICJ. SIDS are also leaders in the new fossil fuel non-proliferation treaty, the launch of which I had the privilege of attending in Antigua and Barbuda. And we also have the Inter-American Court of Human Rights that met in Barbados recently, Climate Emergency and Human Rights. And this is just a snap of the fossil fuel non-proliferation treaty, which we have signed on to. Because really fossil fuels the continued use of fossil fuels is destroying our future. And we've got to deal with that. A few concluding remarks. This is what I've been saying. Patient Earth is sick, and this is bad for all life, and definitely bad for humans and our institutions. I have a few provocative statements here. The continued use of fossil fuels is destroying our future. If climate change is the #1 public health problem of the 21st century, where are the public health education campaigns? CARICOM, PAHO, 5Cs all have public education as pillars in their plans. I want to see those pillars manifest. Here's a question for you. Would you put an arms dealer in charge of arms control talks? Or a tobacco baron in charge of tobacco control talks? And how in the world we have countries and presidents of the climate COPs who are big CEOs of oil companies? The conflict of interest is just so huge. I hope citizens would rise up and say, enough of that. You cannot put somebody as the president of the climate control talks who is a oil company CEO. Too much conflict of interest. Is the rhetoric that climate change is caused by the big countries like China and America contributing to the leisurely pace of response by the Caribbean? Is it really true that we are not part of the problem when our food, our clothes, our cars are manufactured by countries that we blame? Are we being hypocritical? Are the Guyana ExxonMobil oil fields really necessary for Guyana's development? Or is it one more nail in the coffin of the millions who will die as a result of climate change? Health-harming industries like big oil, big tobacco, big food, big alcohol, arms, they're operating from the same playbook to lie, deny, deflect, delay, and fund bogus studies to undermine the science. This is something that we have to tackle in a serious way. It will require a lot of careful messaging and maneuvering and recognizing that many of our own governments are conflicted because these companies fund political campaigns. This is a piece from Nick Frudenberg, WHO Commercial Determinants of Health Seminar, speaking about the political economy of some of the changes that we need and asking, can't we bring together the scholarship around studying the common playbook and join the NCD response to the climate response? So I thank you. In conclusion, climate change is causing increasing, ubiquitous, unrelenting, unfair impacts on us and the health services. Much can be done, and the role of law will be important, as it has for many previous public health challenges. Thank you very much.
Thank you, Dr. Hospitalis. Indeed, I was intrigued. You called it a wake-up call, and I would like to think that for all of us, it was a wake-up call. I don't think we entertain what we're up against. You know, we're looking at unprecedented and unrelenting, and you gave examples of that. So thank you so much for that. As we continue, we're now going to go into our brief question and answer session. We're just going to have about 5 to 10 minutes for questions. Please feel free to raise your hand as you address your questions to the speakers. The speaker, unfortunately, Dr. Paulson had to leave due to another conflicting event. But of course, we do know that we have an expert in the forum, and so by no means will your questions not be answered. So at this moment, ladies and gentlemen, I welcome you to address your questions, raise your hand, or feel free to use the chat, which we will review for the questions.
Dear Shana, you may start with the one that has been posed in the Q&A.
Yes, okay, so there is a question from Patricia Lewin. And this question is directed at Dr. Hospitalis. It says, thank you for your presentation. Given the challenges you mentioned regarding the necessity of addressing climate-related challenges with the health sector, what steps or initiatives should Caribbean states prioritize to enhance their capacity to integrate the climate change in health policy or law? Even though you alluded to public education. It's a lengthy question. I possibly we could take the first part and then ask the second part, or would you prefer that I read the whole thing?
Can you just read it again, please?
Okay. So Patricia is asking, she's saying, given the challenges you mentioned regarding the necessity of addressing climate-related challenges with the health sector, what steps or initiatives should Caribbean states prioritize to enhance their capacity to integrate climate change in health policy or law? And the second part, well, the addition to that, she says, even though you alluded to public education, but will/could action be too late in responding? That's one part. And then, are there successful examples the region could learn from? And then, where do we start?
Wow.
Yeah, it
Okay.
is a mouthful, but I can sense her concern. I can sense, that she definitely wants something done about it. She does also mention that, especially since there are many other challenges associated with the healthcare sector in the region.
So that was a lot, but never mind. So it's never too late. Every 0.1 degree that we can avoid of temperature rise in this world means less death and less suffering. It's never too late. And so we once you learn about this, you have a duty to work on it. And one of the risks is the size of the problem makes us think there's nothing I can do. And you feel a sense of doom, and that's called doomism. And in my experience, the best antidote to that is to start to act. If you're in the health sector, start to educate your patients, start to learn more about the problem, get equipped about it, because largely doctors and nurses are still sleepwalking where this problem is concerned. And our health ministers, again, they've heard about it, but they still have a ways to go. Where to start? Well, already a lot of things are already going on. PAHO, Dr. Karen Paulson indicated what she's up to. But most of the agencies are doing SEDEMA, CIMH, our sort of Met umbrella, Met Services umbrella are doing things. I mentioned several of the leadership moves that are being taken by our small island states on the global stage, frustrated by the slow pace of progress, to bring the climate change issue into the international law fora and the different mechanisms. So we have to continue on that line and length. We have to continue to advocate for access to resources based on vulnerability, and we just have to keep at it, recognizing that, you see, we've been talking about climate change and science, but what we're up against is greed, selfishness, apathy, and ignorance. The people who are putting profit before the health of people or the health of the planet, that's what we're up against. Fundamental drivers like that. And so the Bible says you have to be innocent as doves and shrewd as serpents. You have to recognize that's what we're up against. And this is not a short campaign. This is a long campaign. Health is kind of late to the dance. It was not mentioned by Karen or myself, but the Paris Agreement, which governs governmental responses to climate change, mentions health. Do you know how many times? Once in the preamble. So for all these last 20 plus years, the folks who have been meeting on climate and environment and trying to figure out how to deal with climate change have mostly been environmental and climate types, and health has not been at the table. It's only in the last couple of years there's a realization that health is impacted. Furthermore, that health action can strengthen climate responses and vice versa. So the question of how to integrate climate into health, I touched on some of those in my presentation. I'm happy to share it. I think it begins with our heads of government. I don't know about beginning, but we need them to declare climate resilient health systems are a priority for our countries, given what we face and given the death and disease and suffering that's coming with it. And I think the health ministers, the Council for Human and Social Development, need to wrestle with this. They haven't yet. Our chief medical officers met in April in, where did they meet? St. Lucia. And climate change was not on the agenda. Not on the agenda. Does this suggest that it's a priority for us? Not yet. So our own chief technical officers in health need to get more educated about this. Now, we've been around this block before in the sense that big public health problems, go back 25 years, 30 years, HIV/AIDS. It took a while for people to realize the severity of it, the economic impact, and for the health officials and others to wake up to it. The Caribbean was part of seeing that it went to the UN in New York in 2005. The same with NCDs. It took a while for the realization that non-communicable disease was a serious public health burden and a big cost, and for it to go from Geneva with the World Health Assembly to New York. We haven't succeeded yet with NCDs. And in fact, almost no country is on track for the target in the Sustainable Development Goals. And part of my thesis is that that's because the drivers, the commercial determinants upstream, are so powerful that they're actually driving the destruction of the planet and NCDs at the same time. And that's why I'm advocating for a joining up of climate activism with the NCD response. So I think, you know, a further answer to where to start is the more vulnerable populations. We already have disaster plans, and we're good at that. We must check that the vulnerable populations are integrated into that. People with NCDs, people with disabilities, people who have insulin-dependent diabetes, and so on, need to be integrated into that. So there's quite a lot of stuff to be done, steps and initiatives. Again, I take hope from the law moves the international law moves that are going on, and also from the funding that's now coming on stream. And I'll say one more thing and then shut up. There's actually more funding now available for climate and health than there are good projects. There is more funding than there are good projects. So we need to buckle down and look at what can we do to adapt and mitigate and put together the projects that can attract some of the funding that is coming on stream.
Thank you so much, Dr. Hospitalis. Honestly, that was an excellent presentation. Even your response to the question was, very, very, there was just so much information there, so much, you have this passion that says, hey, this is a problem, and we just can't sit down and say, oh, this is just too much, I can't do anything about it. We need to at least do what we can do. And I especially like the part where you said you spoke about a climate literate health workforce. I think it's a climate literate health workforce, but a climate literate population on a whole, because we definitely have to do that together. Thank you so much, Dr. Hospitalis. Thank you for coming. I know that we don't have any hands up and we don't have any further questions. And so we would be moving to the next part of our business meeting. Thank you so much. We need to do this again, Dr. Hospitalis. Definitely.
Anytime you want to engage in this discussion, I'd be more than happy to.
Okay, thank you so much.
Okay.
Thank you so much.
Bye-bye now.
Bye.